Well, throughout the pandemic, WBZ's Dr. Mallika Marshall has been here providing answers for us, and she joins me now. So, Doctor, how big of an impact will this have on families who have been really waiting for the shot for the little ones?
Right. So, as you can imagine, Mary, very many parents of very young children have been waiting anxiously for this to happen, including my brother out in Los Angeles, who's afraid to travel with his 14-month-old because he wants to get her vaccinated first, and I certainly understand. So, look, the FDA is going to review the data that Moderna has submitted. They will consult their vaccine experts and possibly the CDC and make a recommendation as to whether young children should get this vaccine. But, you know, it's not going to be a slam dunk because, you know, they found that the vaccine seems to be just as effective as it is in adults in the Omicron surge, which is a modest effect. And so they're going to have to decide, is it worth the modest effect with any potential side effects? Now, in the trials, they say they did not see any serious side effects. There was some arm soreness and some, you know, similar symptoms that you get with any vaccine. But I would say, look, if I have a kid under 5, I would wait very carefully to hear what the FDA experts have to say. And if they say it's a good idea, I would want to have my child vaccinated because I think that any protection, especially against Omicron, is better than no protection at all.
So you would get it if it becomes available?
I would.
Well, do you think most families will be willing to get the shots at this point?
So, you know, that's a really good question because only about 1/3 of kids between the ages of 5 and 11 have received at least 1 dose of the Pfizer vaccine. Only about 28% have received 2 doses. So if history is any guide, I doubt that there's going to be much more uptake for kids under 5.
Yeah. And will the possibility of millions more being protected, will that have an impact on the pandemic overall? There's a lot of talk now about whether or not we'll ever reach herd immunity. How do you think this will affect that?
Yeah, so I've heard a lot of people ask, well, you know, what's the point? Because so many kids have been infected, specifically with Omicron, over the past couple of months. So does it make any difference whether we actually vaccinate kids under 5? But I would say yes. Because first of all, studies have suggested that the immune response you get from vaccination is probably more robust than you get from natural infection. And even though kids are less likely to get really sick from COVID, some do get very sick. Some kids go on to develop long COVID and they have fatigue and shortness of breath for weeks, sometimes months. Some kids, a small percentage, will go on to develop that multi-system inflammatory condition, which can be a serious complication of COVID. So I would say if we have a vaccine that has even a modest effect, and we could potentially vaccinate millions of kids nationwide, then chances are that will go a long way to making an impact on the pandemic and actually preventing future infections.
Right.
So,
or certainly at the very least, if people do test positive, making their symptoms less severe.
Absolutely, right, because it's not 100% protective against infection, but it should reduce symptoms if a child were to get vaccinated and then get infected.
All right, still a lot of information to come. Dr. Mallika Marshall, thank you so much.